I'm David Rose, and I'm the Vice President of the Monterey County Chapter for SCIU, representing 3,200 employees. Over the last year, we've been talking with each of you individually as well as making comments about the staffing crisis that we're having in the county. The fact is that recently I came up with a perfect analogy for this. I thought of this as, the fact is that we have a fracture. When you have a fracture in your body, the entire system is weakened. The body is constantly trying to address around the fracture and compensate, but ultimately if you don't directly address the fracture, the body will continue to become weaker, and the problems will flare up in different parts of the body and making the entire system compromised. In this county, the fact is the fracture is our staffing crisis. We're having issues with retention and recruitment. The good news, though, is that you can fix the problem. If you don't directly address the fracture, problems will continue to compound and just worsen. We are losing great people, but we can fix this. There's really easy ways of doing that. Offer better compensation, protect our excellent benefits, including most especially healthcare, and retain our workers by treating them with dignity and respect. Demand our management stop bullying and harassment. We right now can fix this fracture and begin the healing process, but we need your help. So we have a proposal that's going to be suggested to you in closed session. We really urge you to consider it because it is a very fair proposal and a fair start. Thank you.
My name is Dee Guerrero, and I'm an eligibility supervisor for the Department of Social Services. I'm also president of SCIU 521, representing these wonderful, hardworking people here. During the pandemic, our entire membership stepped up to work the front lines to ensure this county thrived. That's because we care about this county. And rather than thank us, we are presented with drastic changes to our health care benefits. Rather than positioning the workforce to focus on the critical rise in service needs such as mental health, child protection, and disaster services, workers and residents are being forced to do more with less. And this will only further impact on health and well-being in this county. Well, we need workers. And we need competitive wages and benefits for those workers to sustain themselves and their families. Competitive wages and benefits are an excellent tool for recruiting and retaining a quality workforce. And working families having good jobs with sustainable wages invest back in their communities, and that's what we need here in Monterey County. We need that workforce that gives back to their community. Because when our communities thrive, our county will thrive, and we hope you would want to see a workforce thrive in a county that appreciates their sacrifices. We look to your leadership. Put a Central County workforce and our community first. Thank you.
My name is Miriam Gomez, and I've worked for FCS for 5.5 years as a social worker. I was born and raised here in Salinas and love my community. I love my work, protecting kids and supporting families here in Monterey County, but I'm at my wit's ends. Due to the constant mismanagement and poor decisions, that continues to leave my department at critical staffing levels for over a year now. Leaving vacant positions open in critical departments such as mine can have severe consequences for the community. Last Thursday, September 30th, we are so understaffed that 20 minutes before the shift was to start, our program manager emailed the remaining staff at FCS asking for volunteers, as we did not have anyone to work after hours that night. That means that from 5 p.m. until 8 a.m. the next morning, there was potentially no one available to take reports and respond to situations involving abuse and neglect of this county's children. This is a serious issue. We are mandated to have a 24-hour hotline, and for good reason. If CHP calls in the middle of the night with a drunk adult and needs someone to take the children into custody where the parents get arrested, there needs to be someone there to answer that call at night. If a therapist or medical professional wants to fulfill their federal duty as a mandatory reporter, we have to fulfill that duty. But that night, if a kid was being physically or sexually abused and called the county in a desperate cry for help, there potentially was no one to take that call. This is unacceptable, and it's heartbreaking. The solution is clear. Offer a better package for workers so that they actually want to come and work here. Not only that, instruct county management to improve working conditions so that employees want to stay here for a long time. We're at a breaking point. This isn't about the money in our pockets. It's about making sure we have someone to answer the call when a kid is in crisis and needs help at any hour of the day. That's why we do this job, and that's why my incredible professional colleagues do this job. Help us do it well. Help us serve the kids of Monterey County. Thank you. Any other public comment in the audience today?
I just wanted to speak on behalf of more of many employers. This community have mandated us to go on unpaid leave due to the fact that we have the right to refuse vaccination. I was told that today by my employer that your department will be making a decision on whether or not we will receive benefits during this unpaid leave, as well as I feel that this is unfair treatment to workers who have been there for our community over the last 578 days without a mandate and showed up to provide for our community. I feel that you guys need to release this mandate. As my employer told, it's up to your department to make that decision so that we can go back to helping out the short staffing that we have experienced for many years in our community and help protect patients' lives.
My name is Scott Bruce-Esketti, and I'm a nurse representative in the Nurses Association of Monterey County. I've been working in the emergency room here at Natividad for the past 8 years, but in the last year I can say with newfound certainty that nurses alone will not and cannot save anyone. It takes a team, a collaboration with many different people and roles. If we don't have respiratory therapists, certified nurses, assistants, housekeeping, social workers, clerical staff, to name just a few of the critical roles that nurses depend on for the very act of saving lives, we're just unable to do our jobs. Unsafe staffing puts our patients, public health, nurses, and healthcare workers in danger. When our frontline healthcare and other vital county workers are dangerously understaffed, our community suffers because they cannot get the care they desperately need and deserve, especially amid an ongoing and unprecedented global pandemic. It will be 2 years now that our nurses have stood on the front lines of this deadly pandemic. And I'm very proud to care and serve for my community. And we as registered nurses continue to give our patients everything we have. We are doing this now without the help we need, but in reality, the staffing crisis is not new. We have met repeatedly over the past year and a half now with our elected board of supervisors, senior administration at the hospital, and county HR in attempts to address the chronic retention and recruitment crisis across our county health facilities. We're calling on our elected board of supervisors to stand with our healthcare workers and to reinvest in patient care, reinvest in nurses and other frontline workers so that we can safely care for our patients and the public. We are dedicated to serve and get us through this deadly pandemic. Thank you.
My name is Jennifer Jean-Pierre. I am a registered nurse in the ICU at Natividad, and I am the chief nurse representative of our union, CNA. As nurses, we cannot do our jobs without the rest of the healthcare staff in the hospital. We need our techs, RTs, labs, our housekeepers, aides, and social workers fully staffed so that we can safely care for our patients. For the past 19 months, nurses have stood on the front lines of the deadly pandemic. We ran into danger to take care of our patients and the community we are part of and dedicated to serve. But the reality is that the staffing crisis is not new. We met repeatedly over the past 19 months with our elected board of supervisors, senior admin at the hospital, and county HR in attempts to work together and address the issues that have led to the chronic retention and recruitment crisis across our county health facilities. Today, we are standing with our fellow SEIU 521 union members and vital county healthcare and other key workers, calling on our elected board of supervisors to stand with our frontline registered nurses and frontline staff to work with us, address the staffing crisis so we can safely care for our patients and the public we are dedicated to serve. I know our elected BOS cares about the health and welfare of Monterey County residents. Today, nurses are calling on you to be leaders and to be heroes and to stand with us. With your leadership and partnership, I know that our unions can work together, put patients and public health first and reinvest in all patient care to finally resolve these staffing issues. I want to thank all of you for the opportunity today and look forward to courage and leadership in addressing the dangerous short staffing so that our nurses and other county healthcare staff can safely care for the patients in the community we all serve. Thank you.
Thank you. And thank you, Chair Askew, for the letter that you emailed me in response to the letter I emailed you yesterday. Today, I want to talk also about the short staffing because my supervisor and the other supervisor on my team are carrying caseloads and conducting assessments of kids who are adjudicated, plus all of their supervisory duties, plus supporting their staff. You know, in behavioral health, our care is preventative because we are treating youth before they become adults when it's easier and their brains are more pliant and receptive to therapy. So we're preventing problems down the road, and we're reducing the frequency of 5150 hospitalizations and other incredibly costly interventions down the road. So we are, in fact, saving you money, and we're also billing Medi-Cal, so we're bringing money to the county. The problem that I'm having is with the short-sightedness, because you've got folks here who are really doing the hard work to make sure that crime is reduced in our communities, to make sure that trauma doesn't happen to other children. And everyone knows the old axiom by Ben Franklin that an ounce of prevention is worth a pound of cure, and that's true. But perhaps the more relevant thing to say today is that it is easier to build strong children than it is to heal broken men, and that comes direct from Frederick Douglass. So partner with us. I'll handle the morale and be the cheerleader. You handle providing us an adequate contract that meets our needs, and we'll just keep moving right on forward. See you next week.
Dicen que tienen muchas interrogantes y tienen muchas quejas. ¿Cuál es la queja? Víctor, cuéntame.
Adriana, la razón por que estamos aquí es para mandar un mensaje claro a la comunidad. Estamos aquí porque queremos protegerlos. Sabemos lo importante que es los servicios que ustedes necesitan, como asistencia médica en el Hospital Natividad, cuando haces una llamada en el 911 del Centro para Comunicaciones cuando tenga una emergencia, servicios sociales. Estamos hablando de cuando aplican para estampillas, para medical, para otros servicios que necesita la comunidad. Y la razón por que estamos aquí es porque también estamos en medio de un contrato con el condado y lo que estamos en realidad pidiendo no es mucho. Necesitamos personal. Esta pandemia nos ha traído cambios dramáticos a todos.
Hay como 600 vacantes en el condado de Monterrey.
Alrededor de 600 vacantes. Es algo increíble. Estamos haciendo trabajo de 2 o 3 personas. Entonces, eso afecta a la comunidad porque cuando una persona aplica para los servicios, obviamente no se pueden dar los servicios rápidamente. ¿Por qué? Porque no tenemos el personal, no tenemos los recursos necesarios.
Entonces necesitan que contraten a todo el personal para continuar haciendo el trabajo.
Correcto. Entonces, necesitamos más personal, necesitamos que el condado asuma esa responsabilidad. Tenemos años con esta batalla de personal, que no tenemos las suficientes personas para procesar los casos o los servicios que las personas necesitan. Y en realidad, obviamente, todos los que están aquí, y como puedes ver, la mayoría de las personas que aplican para trabajar para el condado es porque estamos aquí porque nos importa la comunidad.
Víctor, y también piden aumento de salario y que el condado asuma los costos por el seguro de salud de ustedes.
Correcto. Estamos ahorita, como te digo, en negociaciones y yo pienso que lo más justo es que el condado asuma su responsabilidad y proteja a sus empleados para que nosotros, como empleados, podamos dar a la comunidad lo que la comunidad necesita. No pedimos nada, no es nada del otro mundo, es algo que pienso que es algo justo y que podemos llegar a una negociación. El día de hoy vamos a la mesa con el Departamento de Recursos Humanos después de este evento y vamos a ver qué es lo que ellos traen.
Perfecto, Víctor, muchas gracias. Vamos a verlo. Your title?
Registered nurse and intensive caregiver, and also the chief nurse representative of the Association.
What is the demonstration today about?
The demonstration today is about fighting against staffing. We're here in solidarity with our SAU 521 brothers and sisters. about that. So I stand in solidarity with them. Thank you. Thank you. Thank you.
How you doing?
I'm waiting for a couple of speakers, but I just want to say thank you for coming out here. It takes a lot to come out here. You know, we're still here fighting. Your bargaining team is fighting for you. A couple of us went out to the Board of Supervisors today to let them know there's not enough people here to take care of this community. You know, we just got through a pandemic, and the way they say thank you is by taking away some of our essential services, wanting to make us pay for health care. But we can't do that. We work hard. Where are my heroes at? That's right. We're always out there. We're here in this building. We're out in our community site, making sure we take care of this community. We feed this community. We house this community. And you know what? During the pandemic, we breathed this community. Right. And the way they say thank you is by making us stand up and fight. And we will continue to do that because we deserve it. We deserve competitive wages. We deserve health care. We deserve staffing. They need to fill the 600 shortages that they have so we can stop working at the price of 3 people for free. Very good. When we fight, that's right. Let me introduce Mo Huerta here.
Good afternoon, brothers and sisters. My name is Raul Huerta, and I've worked for environmental services at Natividad Hospital for the last 13 years. I work long, hard hours with my coworkers, 12 to 16-hour shifts, to make sure the rooms and beds are clean and so people don't get sick when they come inside or leave the hospital. But the county doesn't agree. Long shifts or new COVID-19 rules which pile on back-breaking work deserve hazard pay. It is clear to all my brothers and sisters who dive headfirst into COVID-19 hazard without hesitation or fear deserve hazard pay. If the county doesn't acknowledge our hard work during the pandemic, it means they don't acknowledge our dignity and respect. If they won't give us hazard pay, they aren't willing to give us the respect we deserve.
That's right. Let them know.
And as county workers, we all deserve respect.
Yes.
The county isn't thinking about how their decision impacts other people. Do you know how hazard pay impacts me and my family? Hazard pay will help keep my family safe in our little home as rent rises another $200 every other year. We can't keep up with the cost of living, but hazard pay...
It's not fair when the Board of Supervisors can.
But hazard pay will make that difficulty a little bit easier. Hazard pay is a small step in the right direction. We continue to keep the county running despite hazards of the pandemic. Management must prioritize all of our county workers and end the staffing crisis now. Thank you guys. When we fight, who's got the power? What kind of power? We're fired up. That's right. This is when we all come together and show our power right here. I would like to thank the other unions coming to our rally to show support.
We have
Good afternoon, brothers and sisters at CIU 521. Good afternoon to all my sisters. nurses and I are excited to stand here with all of you. With all of you, we stand in solidarity with all SIU 521 brothers and sisters. You're all vital to our jobs as a registered nurse here in the county. You've ensured the health and safety of our community and our patients. As a registered nurse, I could not do my job, and neither could they, and nobody in the hospital working as a registered nurse couldn't do their jobs either, caring for their patients. Nurses work along side by side with our SEIU 521 members here in Natividad and at Monterey County. We depend on each other to provide the care we need for our community and our patients. You depend on us and we depend on you to take care of all of us and one another. We stand along with all of you because your fight is our fight. Thanks for all the patience. Our main goal, we share the same goal as our patients. Our patients come first and they should always be our priority. We are a part of the same team, no matter what you are in your profession or what you do here in the hospital or in the Monterey County. We're all on the same team taking care of our patients. I want you all to know, and the representative of our union, that we stand along with all of you as a registered nurse. You need to know we cannot do our jobs without all of you. Everybody else that I have not mentioned, we need all of you guys. All of you are brothers and sisters in the fight for putting patients first and to stop this chronic short staffing crisis. Thank you so much.
I'm Jake Ginsberg. I'm one of the resident physicians here who works at the hospital. I want to talk briefly about the vacancies and staffing issues that are affecting the hospital and our clinic. Like everyone has said, we get to our job. Provide some of the most necessary services to our community. Patients are waiting longer to receive care for employees stretched so thin to the decreased staff levels. Whether it's in the hospital or clinics, we've got our MAs, our nurses, our social workers, our EDS workers, and all the other support staff that I haven't mentioned. Everyone else, the hospital will completely fall apart. The county needs to take care of all of its employees so they can be able to take care of the people that live here. All workers are imperative to providing quality, comprehensive care and beating the odds of the staffing crisis. And as a union, workers stick together despite the odds. The final round behind our union workers despite the odds now. Let's end the staffing crisis together.
I just saw Enid somewhere. There she is.
that you had to give to your work instead of your family. So let's demand that you get fair pay and we take care of you. We get a fair contract now. My husband works in, let's just say he's on the other side of the dispatchers. So when you call, we need people who are rested, people who are clear-minded, and people who can get them to their calls safely. Right? 610 vacancies is not okay. That's less time away from your families, from sacrifices at home. You deserve a contract now. Right? I'm happy to bring my family. We support essential workers. I will do whatever I can to support you. Again, we're a union family and we understand the sacrifices. So let's get a fair contract now.
More than anything, no matter what the title, no matter anything, I am a proud member of SEIU. We are here today because we stand on the shoulders of our brothers and sisters who sacrificed, who started these unions, everything we have. It's because of union power. Don't let anybody tell you or ask you when you say SEIU 521, you are the ones who have the power. I'm talking about union staff. It's about you as a member who has the power. We are here today as we have been many times before. We know this is nothing new. The county continues to try and shortchange us and give us less than what we deserve. 610 vacancies. I don't care where you work in the county, you're affected by these shortages. They require more from us, but they don't want to give us what we deserve. social workers going out to take care of our children who need our help. We have to increase staffing, training, and we have to increase management's respect for us. As someone has already said, we are stronger together. Don't let anyone come between us. We are family. We might have differences, but at the end of the day, we're all the same. Pay us what we deserve. Treat us as we deserve. We are going to take this all the way to Sisapura!
We're fighting for you. We fight together. That's right. And at the top of that, I'd like to introduce Rico Mendez.
Yeah!
All right,
All
thank
our
you.
beautiful speakers, please come up and join me. I want everybody to join me.
All right.
How we doing today, Monterey County? SEIU. I wish you could all see what I see right now.
All right!
One of the most diverse, hardworking, dedicated group of human beings on this freaking earth. Right here in Monterey County. My name is Rico Mendez. I'm the proud Chief Elected Officer of SEIU Local 521, the most powerful damn union in Monterey County. Let's give it up to all of our brothers and sisters from these other unions that are coming out. We'll be standing in solidarity. Now bosses never give it away. We always gotta fight and take it, always. And the way we fight and take it is together, in unity. That's where our power is. So, if you're ready to fight, turn these hands into fists and put them in the air. Let me see if you're ready to fight. And when I ask you if you're ready to fight, you say damn right. Are we ready to fight? Ready to fight? Ready to fight? Ready to fight? They can hear us inside. So you know what? We're gonna sing them a little song to let them know who we are, okay? Goes like this. Everywhere we go, people wanna know who we are. So we tell them we are the union, the mighty, mighty union, fighting for justice. And our community. All right, I think they heard us, folks. We got
got some serious business to discuss right now. Because 610 vacancies, a 911 staffing crisis, doesn't just hurt us. It doesn't just hurt workers. Who does it hurt? Exactly. And do we care about our community? Do we love our community? Do we love our family and the children that we raise in this community? I grew up my whole life in Soledad, California, right down the street. I was born right here in this hospital. The passion and the love that comes out of this valley is unmatched around the world.
That's right.
We take care of each other, and we care for each other, and we do what we got to do to survive here in this valley, okay? And we got a big spectrum of people, right? We got some billionaires in Carmel. We got hardcore farm workers that just came over from wherever looking for a better life to help their children and their families, sending most of their money back home so they can help their people live, right? That's who we are in this valley. But if somebody gets hurt, if somebody breaks their back, they're in a serious accident, which hospital are they going to take them to? Natividad Medical Center. Why? Who knows why? Because this is the state-of-the-art, world-class trauma with all of the workers that work to contribute to that. It's right here. It don't matter if you're Clint Eastwood in your mansion or you're a farm worker putting food on the table. If you get hurt, they bring you to Natividad Medical Center. We know our community struggles with gang violence, don't we? Yeah. It's something that we try hard to keep our children from getting involved in, but it's a serious problem that's existed here for a long time. When we call 911, when there's a serious incident, somebody needs help, somebody needs health care, somebody needs medical response, what do we want to happen when we call 911? We want help.
Yes.
We want help.
Yes.
And right now, decision makers that are voting yay or nay on whether to do something fair or not are putting the community at risk. There's no reason to have a 911 staffing crisis, is there? It's a conscious decision that the leadership is making to create those conditions. You are the heroes and the sheroes that are sending that message on behalf of the community to change that. Many of you have felt exhausted when you've come home from your shift. Tired, hungry. But the next morning we take that badge and we badge up and we come back to work, don't we? 610 vacancies. What does that mean? It's not just a number on a board. It's not just a number on a piece of paper. 610 vacancies represents core social services that the most vulnerable people in our valley need that are not getting them. And it means the workload on all of us is what? 2, 3, 4 times higher than it should be. That is not a sustainable way to run a county. The people that are lifting up that situation and are willing to do something about it is us and our allies. That's why fighting matters. Protecting our health care, essential. Fair contract now shows respect. So this county needs to do a few things that I think we all agree to. They need to respect us, they need to protect us, and they need to pay us. By doing that, that investment doesn't just help us and our families, it helps every single human being that lives in this county. And that's what they don't understand yet. But by being here today, and by going after this and talking to your coworkers and sharing your stories over and over again, that's the only thing that moves these types of boards. Our bargaining team is going to do a great job. But their proposals and putting them across the table, whether the boss says yes or no to those proposals, proposals, it's got nothing to do with how awesome our bargaining team is. It's got everything to do with how loud and how proud we can be here today, back in our work sites, all those mid-level managers that are shaking in their boots when you're doing marches on them and giving them a petition, refusing to leave that office until together you get answers. That starts getting them shaking in their boots. So you know what they do? They start calling their bosses. They say, you know what? I told them what you told me to tell me. I brought them into my office and one-on-one to scare them. I shifted their shifts around to try to mess with the union leaders. But you know what? It ain't working.
Not working.
They're not shutting up. They're not leaving. Get a fair deal now. They start calling those board of supervisors. Our community steps up and says, you know what, board of supervisor, Alejo or Askew or whoever it is, when I call 911, I want my family to know that we're going to be protected and safe. What the heck are you having a 911 crisis for? This morning, Steve, David, a lot of others spoke at the board of supervisors just this morning. I watched it on Facebook Live, okay? I was driving down here. And I saw one story in particular. A woman named Mary Lou, who's a social worker, right, here in the county. She shared about how they didn't have enough coverage in Family Children's Services to make sure the emergency response would happen if somebody called with an emergency for a child. They didn't have enough staffing. They were out of compliance. As a county, we're supposed to be able to provide that to children, safety to children, 24 hours a day, 7 days a week. But they didn't have enough people to do it. Is it because we're unwilling to work? Heck no! It's because they're not putting the resources on the table necessary to fill those darn positions. Nobody here wants to see a child suffer. Nobody. So by standing up for what's right for us, we're also standing up for what's right for the community. For the children that we love and care for, and for those vulnerable little people, right, that can't advocate for themselves yet. It's our responsibility to step up and make sure that they have those services. So if the county ain't gonna do it, we're gonna make them do it. That's what it's gonna take. Don't give up. Use your voice and stick together. That is the power of a union. Standing together in solidarity. Backing each other up and taking responsibility for our own destiny. No one's going to do it for us. We got to do our part. Being here today is exactly that. So keep up the fight. Don't give up. And you know what? You're not alone. Because our union represents over 52,000 people in our local alone. Okay? Are we ready to fight? Are we ready to fight? Are we ready to fight? S-E-I-U, 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 S-E-I-U. Give it up to your bargaining team. Peace and brother.
We
condado de Monterrey, Departamento de Servicios Sociales.
Muy bien. Platícanos, Víctor, ¿qué está pasando aquí? ¿Qué es lo que están exigiendo ustedes como sindicato, como unión?
Pues mira, con el sindicato de la SEIU, lo que estamos básicamente en este evento estamos mandando un mensaje claro a la mesa directiva del condado de Monterrey y también al Departamento de Recursos Humanos. Estamos ahorita prácticamente en medio de negociaciones. El contrato se nos expiró desde junio y entonces estamos aquí porque tenemos una crisis. Estamos durante la pandemia y todas las personas que vistes en este evento estamos demandando que el condado nos respete, nos proteja y nos dé los recursos que necesitamos. Algo que es en realidad, digo yo, parejo para todos. Obviamente sé que todo incluye un costo para el condado también, pero nosotros como trabajadores necesitamos y sentimos la necesidad de proteger nuestra comunidad. Si no tenemos los recursos, si no tenemos los empleados necesarios, pues no podemos hacer el trabajo eficientemente y esta es una crisis que ha pasado por años ya en este condado de Monterrey.
Ok, entonces para entender mejor, ¿están ustedes, digamos, negociando los nuevos contratos, aprovechando que se tienen que renovar los contratos para exigir mejores condiciones y además están exigiendo que se contrate a más gente?
Correcto. Hay una crisis ahorita actualmente y te puedo hablar de diferentes departamentos, pero en específico quisiera hablar acerca del departamento del 911, donde tenemos empleados que están trabajando doble turnos, están muy cansados y no tenemos los suficientes personal. Yo me imagino a mí, como tú y yo, podemos sentirnos a gusto cuando tengamos una emergencia. Yo, al menos por mí, por mi familia, ¿verdad? Y mi comunidad. Quisiera que hubiera alguien allí y que pueda recibir la llamada del 911 cuando tenga una emergencia. Pero lo contrario, también ellos están sufriendo porque no tienen el personal necesario. Y obviamente la calidad de vida de las personas es muy importante y es crítico. Creo que, según el reporte y el análisis que me dieron, 25% nacional, Monterey County tiene esa crisis en empleo. Y la otra de las razones es el problema de la retención. Si no tienes buenos sueldos, pues ¿quién va a querer aplicar para el contrato?
Okay, entonces, ¿ustedes creen que esa es la razón? ¿Que no pagan bien, por eso no tienen suficientes empleados? ¿O por qué creen que no tienen suficientes trabajadores?
Pues obviamente la retención. No tienen un sistema adecuado para retener sus empleados. Y ahora sí, vamos al tema de la aseguranza. Es otro de los ataques que ahorita ellos trajeron a la mesa y quieren que los empleados paguen 1% más sobre la aseguranza de salud. Entonces, la aseguranza es algo que atrae a muchas personas a trabajar para el condado de Monterrey. Y ahorita con este ataque, pues dime tú, ¿quién va a querer aplicar para el condado? Si de por sí ya el personal es maltratado y está trabajando 2 o 3 trabajos de 2 o 3 personas. Ahí tenemos la crisis en servicios sociales. Natividad, las personas que vienen a agarrar asistencia médica están esperando más porque tienen que esperar, no tenemos las enfermeras o el personal adecuado para atenderlos como se merece.
Claro. ¿Cómo van las negociaciones? ¿Han avanzado? ¿Ustedes ven que el condado tiene disposición o sienten que el condado está cerrado a lo que ellos nada más dicen? ¿Cómo sienten ustedes que va la negociación?
Mira, honestamente, te voy a ser sincero, el equipo de la negociación de SEIU, que son la mayoría, pues obviamente todos son empleados del condado, estamos preparándonos y nos veníamos preparando desde noviembre del año pasado. Empezamos negociaciones meses atrás con ellos y cada semana es la misma. Nomás no podemos llegar a una conclusión. De hecho, ahorita saliendo de aquí, vamos a ir a la oficina que está allá por el aeropuerto en Shillings, donde vamos a reunirnos con ellos para ver qué es lo que van a terminar de decir. Hoy es un día importante. Yo sigo optimista y creo que ojalá y el día de hoy se tome una decisión. No nada más para los trabajadores del condado, pero para la comunidad en general. Porque los que estamos aquí, todos los trabajadores que están aquí, somos personas que estamos, ¿cómo te diré? Aportamos mucho para la comunidad y nos importa nuestra comunidad. Porque no es tanto acerca del pago muchas veces, pero es acerca de los servicios que ellos necesitan. Le puedes llamar servicios mentales, servicios médicos, programas para las estampillas, medical, o sea, hay tantas variedades que este condado tiene fuerte en muchos recursos, pero obviamente y lamentablemente sin el personal, pues desafortunadamente no se puede dar abasto para poder esos servicios.
Exacto. Más o menos como cuántos trabajadores tiene el sindicato aquí en el condado de Monterrey, ¿tienes una idea?
Arriba de más de 3,000 o 4,000 trabajadores que representa el sindicato de ISL.
Y hoy solo están los que pudieron dejar un rato su trabajo.
Correcto, y volvemos a lo mismo, es porque una de dos, o unos trabajan de casa o tienen un horario restringido donde no pueden, obviamente por requerimientos de su departamento, no pueden salir a protestar o pues estar en este evento en solidaridad, ¿verdad?, con las otras personas del condado.
Una pregunta que te va a hacer fuerte, pero que bueno, pues ya tú me dirás cómo me la respondes. ¿Han pensado en la posibilidad de hacer paros laborales si no se llega a un acuerdo? ¿O cuál sería como el siguiente paso en caso de que sigan atoradas las negociaciones? Porque sé que han hablado ustedes adentro del sindicato.
Sí, lo que puedo decir es, los trabajadores están listos y yo veo que están cansados. Durante esta pandemia creo que ha afectado muchísimo los estragos, porque no nada más en lo personal, ha sido casi 2 años de que muchas personas trabajan de casa, algunos otros están trabajando en la oficina, entonces estamos aquí desde el día del cierre y estamos proveyendo los servicios que las personas necesitan. Y entonces para responderte la pregunta, vamos a ver qué es la decisión que va a moverse de aquí en adelante, pero esperemos que todo lo que vaya a suceder sea algo justo para todos, tanto para el condado como para la comunidad y los trabajadores del condado.
Pero todas las opciones están puestas en la mesa.
Correcto.
En caso de que no se diga. Ok, gracias.
Sí.
¿Algo más?
No, pues muchísimas gracias y un mensaje para la comunidad. Mi nombre es Víctor Cárabes otra vez. Soy un residente del condado de Monterrey, casi más de 21 años. Estoy familiarizado con todos los servicios, las necesidades que ocupa la comunidad, y en realidad, como les decía, este evento fue organizado principalmente para atraer atención a la comunidad y que sepan que estamos con ustedes, nos importan sus servicios, los programas que necesitan, y estamos luchando, ¿verdad?, para seguir proveyendo esos servicios. So basically the goal of this rally is just to bring attention to the board of supervisors so that we are ready. And this is the time that they have to make a decision and bring directions to HR management so that we can have a fair contract for everybody, and also so that we can continue to provide those essential services and programs that our community needs.
And you mentioned in Spanish a little bit about the importance of the 911 calls and about what they're experiencing there in the emergency center. Can you talk a little bit about that, please?
Right. So for the 911 department, for the communication specialist workers, it is a crisis right now. So I can picture myself having to call 911 and nobody's there to answer my call if I have an emergency, right? And it is a crisis because they have a lot of vacancies. Their people are understaffed, mistreated, very bad, and they're tired. And I think this is a time that we need to invest in our community, but by investing in getting more people, hiring more people to be qualified to work in the 911, that would be one of the goals as well.
And you said that you're going to meet after this. Can you talk a little bit about what's being expected?
Right. So we're going back to the table right now as we speak, almost in about 20 minutes. We're going back to negotiate with the county. And my hope is that we actually have a fair contract today. It's been several months, week after week, meeting with them, and every time it's the same conversation, rejections over rejections. We have talked about the healthcare, we have talked about the wages and other languages in the contract that we actually are bargaining right now. But the most important thing is the healthcare, because the healthcare is one of the things that make people to work for the county. And if they're attacking the healthcare, then what's the purpose to apply for the county? I mean, I'd rather work with the private sector. They pay more.
And can you tell me a little bit about what is expected in terms of what actions can we talk about that would be further taken in terms of our plans after this negotiation? Things don't go.
Right. So what I would say to that question is, county workers, they're tired. There's a crisis during the pandemic. We've been through this for a long period of time already. Since the shutdown, since day one, we were here serving our community, providing the vital services, the programs that they need. Even myself, as a personal story, I mean, I was deployed 3 times in different places within the county to serve the most vulnerable residents in this county. And so I think, I mean, I can't tell you exactly what the call will be, but I think the workforce is ready for what comes next. And I hope that the county answer this call and we can come up to an agreement.
Hi, my name is Jennifer Jean-Pierre. I'm an ICU nurse here in Natividad, and I'm a Salinas resident. We were brought here today because we are part of our union, California Nurses Association, which I am the chief nurse representative of from Monterey County. We are standing in solidarity with our brothers and sisters from SEIU 521, fighting the crisis that we've had with short staffing. It's been a chronic issue that we've had here at Monterey County, and we stand with them because as a registered nurse, I couldn't do my job as a nurse here in the county at Natividad in the intensive care unit without all the SEIU 521 members who work in profession in the lab, housekeeping, respiratory therapists, social work, and many other professions. We couldn't do our jobs as nurses without them. So their fight is our fight, and we stand with them. And that's why we're here to show our support, because we are taking care of our patients here in the community, and we have the same goal, making sure our patients and our community gets the care that they deserve.
And what do you hope that the county responds in regards to this?
Our hope that the county will respond to filling those vacancies, making sure our staffing is up to par to our patient load, and that we no longer have chronic short staffing. It's not something that happened overnight. It's been a chronic issue ongoing for many years. We've been having to work without and working more with longer hours, and we haven't gotten the support we needed to do our jobs. And when we don't have the adequate staffing we need for our patients are the ones who suffer, and we don't want that to happen any longer. So we're here and fighting that fight and making sure the county does their part in their leadership role, because they've been elected by all of us to do their part in making sure they're ensuring our patients are taken care of and that we can do our job.
Yeah, why do you think this has happened, this shortage, national-wide, but here in the Monterey County?
I think for Monterey County itself, like I said, it's chronic, meaning it's been going ongoing. They never fixed the issue, and I think it's because they were expecting the staff to continue working the way they are, mandating long hours, putting extra shifts on, the already burnt-out nurses and staff members here in the healthcare facility, that they just never figured out how to fix it. And a lot of the part has to do with competitive wages. They need to be competitive. We love working here. I live here in Salinas. I love caring for our patients. They're special to us, and we're the only trauma hospital. But they have to have the respect for the staff to make sure that the wages are competitive and also the work is safe for all of us, and that we have the supplies and equipment and people to help us to do our jobs as nurses.
So just to confirm, you're employed by Natividad, correct?
Yes, I'm employed by Natividad.
So we're out here today in terms of supporting SEIU, correct?
Right, yes.
Okay.
And California Nurses Association, our union, here at the Monterey County, we're in support of SEIU 521 because their fight is our fight. They're doing our job and helping us care for our patients, and we stand with them because, like I said, as nurses, we can't do our jobs as nurses without them. So they're vital into the healthcare team and for us to take care of our community members. Without them, it's going to be really difficult for nurses to care for patients effectively and giving them the care that they deserve.
Okay, great. Those are all the questions we have. Is there anything else you feel like it's important to add that we didn't ask?
I just want to add that it's been a long fight, and we're going to continue fighting because it's the right thing to do. And we want our community to back us up because as we bargain for our contracts, SEIU 521 and our contract, California Nurses Association, I want the community to know that we're bargaining for you. What we get on the table on our contract affects all of us here that lives in the county. Our rights and protections for our patients and for our licensure and our staffing affects everybody that comes to the hospital providing care, that receives the care, that comes here to the emergency room, that has an unfortunate trauma that it solely directly affects all of us. So it may not be, apparent to everyone to know that our contract affects them, but it does, because if we don't have the rights and protections and things that we need in the staffing that we need to take care of you, your health care and your life is at risk.
My name is Yvette Carrion, and I'm a supervisor for Monterey County, and I've been working here for about 21 years. The purpose of today's rally is really to support the workers that we have here that's been working very hard, holding down the system, making sure that the public is serviced throughout this pandemic. So we're really having a crisis here. The crisis here right now is really the shortage of staff that we have, shortage of emergency response to the community, and also the health care. So combining those two, it really adds a significant impact, not only on the workers, but on families and the communities that we serve.
Can you tell me a little bit about what you're seeing specifically in the department that you work in?
Sure. So from all the departments here, from what I've observed, is that all the workers are really being asked to cover a lot more of the positions because we don't have enough staffing. So emergency is affected, healthcare is affected, behavioral health is affected, and as you know, if the community calls us and say, hey, we need help, whether it's medical, psychiatric, we need to be able to have staffing to provide those services to the community. And that won't happen if we have a shortage in the people staying here. So everybody's moving out. As you know, Monterey County already has a high cost of living increase, and now we're also being threatened with rising costs of insurance. So what does that mean? We're going to lose more staffing. We're not going to have enough people right here on the ground making sure that services are provided for the community. So it's really just such a bad time to do this, to hit the workers that are essential workers that have been holding down the operations here day to day in order to be available to the community.
I kept seeing posters there was about like 600 vacancies or something like that.
Yes.
Can you talk a little bit about that just so I
Sure.
can get information on
So
that?
having these vacancies put a lot of pressure on the workers. That means they have to cover all the other vacancies that needs to be filled in order to continue to serve the community. So a lot of that happens here is that people get burned out, people leave the county even though they want to work here. There's just not enough people to sustain, responding to the community when that happens.
So are these vacancies in terms of something, is it because people are just not staying, or why do they, I guess, keep remaining vacant?
There's many reasons for it. One of that is the rise of healthcare, the rise of cost of living in this county. Even though people want to work here, they're proud to work here, they need to go somewhere else in order to afford a house, in order to afford just a fair living for their family, to support that. And the workers here are part of that community as well.
So this basically doesn't not only impact the workers, but it also impacts the community from what I heard that was given in the speeches in the rally. Can you talk a little bit about that, please? How it trickles down and also plays a role with the community?
Sure. When there's a shortage in the county for workers, one example that was given was that, hey, somebody calls 911, somebody calls the crisis department, somebody calls, the health department when they need something. Let's say, there's medical reasons for that, psychiatric reasons for that. If you don't have enough workers, then there's nobody to respond. That really just is as simple as that. So that's why it affects not only us, it affects the whole community because we don't have enough people to respond to these essential emergency crises.
And what is hope that the action is taken from the county and supervisors?
We are hoping that they understand that during this whole pandemic, these essential workers have been here holding down, in order to continue providing these vital services to the community. And it really is not a good move to increase the healthcare costs when there's already a total increase of cost of living in the area. These are workers that are here 24/7 to make sure that the community is safe and that they're responded to quickly.
I wanted to ask you something like, if we talk about 600 people needed, how many workers does the county have in order to compare the people that is already working plus the people needed?
It really just depends. So each department has a ratio of staffing they need to make available. So that's different
from all the departments. It varies. So I really cannot tell you that number. What I can say is that across the board, there are shortage of staffing, and we need people here to serve the community. I think it's worth to mention that, when people give as much to the community, it's important to support them, to make them a valued member of this community, because we all give to each other, and really it affects us all, and we're all in this together. Really, that's what I want to say.